Welcome, friends of Healthway Compounding Pharmacy, and today we have Dr. T with us.
Hi there.
Dr. Topouzian, how you doing today, buddy?
I'm doing good. It's Friday, TGIF.
Thank God it's Friday. So, Dr. T, tell us about your office real quick. Where are you at?
But my office?
Yeah.
Well, I have an office in Saginaw. We're in wonderful Saginaw, Michigan today. Also have an office in Bloomfield Hills and in St. Joseph, Michigan, right on the water.
Perfect. So, for Healthway Pharmacy to get a hold of us, our phone number is 989-791-1691. And to call you, Dr. T, what's your phone number?
248-302-0473.
Perfect. So, question for you.
Yes, sir.
What are some things you've been seeing a lot lately? What are patients asking you questions about?
Thick blood. Been seeing a lot of patients with thick blood, aka coagulation disorders.
Okay. And so what?
Why? You ask me why?
Yeah.
Well, because unfortunately, it seems like just about everybody has either gotten COVID over the past 3 or 4 years, or they've gotten the vaccine, and that has caused a risk factor for thick blood. The technical term is immune system activation of coagulation.
Okay.
And basically, if I can continue,
Yeah.
what happens is that our blood has fiber in it, but we don't call it fiber because that would sound weird. It's fibrin, okay, but it's actually fiber, and it's microscopic, like little lines in your blood. And what happens is, when you get COVID, when you've had an infection, or if you get the vaccine, you get this risk factor where the fibers that are in your blood will start to stick together. Okay.
Interesting.
And so then you've got like all these fibers, even though they're microscopic, they're sticking together, but then they can get stuck in a smaller artery, as it's traveling through your blood.
So it makes like a Band-Aid.
Not really a Band-Aid. It's like, it's like a little, it's almost like a little snowball that's, like, if you will, running through your arteries, and it gets stuck. It gets stuck somewhere, or it can get stuck somewhere. And then that's a risk factor for having, a blood clot or a stroke or a heart attack, depending on where it gets stuck, which is not a good thing.
Right. So what would be some things that we could use over the counter? What would be something you treat with?
What we're doing is we're using like enzymes, okay, to digest the fiber that's in your blood, okay? But the thing about it is that you can't take it with food. You have to take it on an empty stomach. And there's probably, half a dozen different enzymes out there that'll work. But we've been using nattokinase for the most part.
I got some nattokinase right here.
Nattokinase, okay, which is an enzyme, and then we'll also use something called bromelain.
Bromelain, it's sometimes found in digestive enzyme.
Look at that.
Which I know that comes from pineapple, so
it does.
You could eat a bunch of pineapple, I suppose.
Yeah, I mean, after a while though, you're going to get sick of that.
Yeah, true.
Okay, and then if you're eating too many pineapples, it might raise your blood sugar. But anyways, besides that, and curcumin.
Curcumin. We got a curcumin right here too.
Right. So these three things have been shown to help digest the fiber or the fibrin that's in your blood. And again, it has to be done in an empty stomach. So the question is, how often or how long of a period do you have to do this? I mean, I've noticed that it takes anywhere from 3 months to 2 years to get people to a point where they don't have these risk factors for thick blood. And you can test for this. I can test for it. Your doctor can test for it. There's blood tests that you can test to see if you have these risk factors.
Okay. Well, I got to take these for anywhere from 3 months to 2 years, but this is a lot of pills.
Yeah.
So, is there something easier?
Maybe if someone would combine all three of those into one product, that would make it easier.
Wouldn't it?
Yeah.
You got an idea for something like that?
Well, I think so.
What do we call this?
Super Natto.
So here at Healthway Compounding Pharmacy, we created this Super Natto, Dr. T Super Natto.
You're godlike.
With Dr. Keri Topouzian here.
You've created something.
And it's got everything in it. It's got bromelain, curcumin or turmeric, and nattokinase.
Right. And so you take 1 or 2 of these on an empty stomach once a day. But, I mean, and it's a pretty safe product. The only side effect that you could possibly have is if you start bruising, then your body's telling you that it's too much. But honestly, knock on wood, I haven't had anybody, careful,
Oops.
haven't had anybody where that's happened to yet. But you really should. I mean, you want to get your blood tested ahead of time to see if you actually have this condition, and then you follow it. If you do have it, you take something like this, and then you follow it over time until it goes away. Again, this is not a genetic issue that you have of clotting. This is something new that people are developing, and unfortunately, I see it every day, at least every day that I'm working. Okay, not on weekends. I don't see it on the weekends.
And so
Okay.
take this until you have some sort of follow-up lab test that kind of
Correct.
shows things are looking good.
Correct.
All right.
And then the only reason I would say that you wouldn't take this is if you're already on a blood thinner from your doctor for some other condition. In that case, then you're like duplicating, and it might not be a good idea.
Obviously, I'd recommend seeking advice from your physician in that aspect.
Sure.
Before you take something like this.
Yeah. If you're not seeing me, ask your doctor before you take anything. Any
Perfect.
supplements like this.
All right, and these are both available with Healthway Compounding Pharmacy and with
In
Dr.
our office
T.
too.
So your website is
AskDrT.Weebly.com.
perfect, and this is on the website too, right?
Of course.
There we go. All right, folks, if you have any questions, give us a call, 989-791-1691 at Healthway Compounding Pharmacy.
And at 248-302-0473 at Dr. Keri Topouzian.
And we're out.
We're out.